We begin with the number of new COVID-19 cases in Singapore. Of the 675 new cases today, 2 are Singaporean or permanent residents. It marks the 4th straight day that the number of community cases is below 5.
Foreign workers living in dormitories continue to form the majority of the remaining cases. More details will be released later today. The total number of cases in Singapore now stands at 25,346.
As we've seen, the number of cases in the community has continued to fall to an average of 8 daily cases in the past week.
As for the situation in the foreign worker dorms, an average of about 700 cases was reported each day in the last week.
For some insight on the recent figures, we spoke to Associate Professor Alex Cook earlier today. He is the Vice Dean of Research at the Swee Hock School of Public Health at the National University of Singapore.
Well, thanks so much for joining us, Professor Cook. So the multi-ministry task force said yesterday that we're on track and the circuit breaker has shown promise. So 2 questions for you to start this discussion. How would you assess how Singapore is doing at this point? And do you think we are past our peak yet?
I think if you look at the general community, the situation looks quite favourable. We've seen a reduction in the number of cases over the duration of the circuit breaker. We're now down to around about single digits, which at the beginning of circuit breaker was what I'd kind of been hoping that we might potentially get down to. So in that sense, I think that it's been a big success so far. I think if we look at the situation with our foreign workers in dormitories, obviously that was something that was a bit unpredicted at the beginning of the circuit breaker measures, and is a very large number of cases that we've seen there, and yet the situation does not seem to be escalating quite as much as we had feared at some points over the last few weeks. So I think that generally the situation is better than might have been hoped for. The second question you had was, are we past our peak? I think that we're seeing in a lot of other countries at present the relaxation of the circuit breaker period, and then that has been potentially associated with a rise in number of cases that they're seeing. And it seems to me that it is unlikely that we are past peak. We may be past the peak for the first wave of infections, but if in a period after circuit breaker, if we are not moving to a situation where we're actually controlling the epidemic, we're letting it become unmitigated, then I think that we can expect to have a large peak going forward. So it will be very important that after we move into the post-circuit breaker period, that we don't expect that life is going back to normal, and that we continue to keep our vigilance up to prevent the second peak from being severe.
Now, Prof, that said, what is the worst that Singapore can expect? How many thousand cases a day, for instance?
It's a good question. If you look back in time to the 2009 pandemic of influenza that we had just under maybe 1 million people infected over a period of about a bit less than 2 months. So, and that was in a more or less unmitigated epidemic of a new virus. And so if you do the maths for that, then that's kind of equivalent to maybe something like maybe 50,000 cases a day at the peak of that influenza pandemic. So I think that is one possible outcome of what might happen if we move towards a situation where we have an unmitigated epidemic of COVID. And that really has to serve as a kind of a warning that we must avoid having something similar to what happened in 2009, because the virus that causes COVID is more transmissible than influenza, and it seems it is more severe. And therefore, we need to make sure we do more to try to prevent transmission.
Right. So, Professor Cook, I just want to go back to what you said earlier, that you think it's unlikely that we have reached our peak. So, what are the signs that we should look out for that we are at that stage? Do we have to refer to a very specific number of daily cases?
So when we pass the peak, we'll know that we passed the peak because we'll see that the number of cases is going down. I think the question is maybe not so much about whether we are past the peak, but rather how has transmissibility changed in a period from circuit breaker to post-circuit breaker? And that's something that we can look at by looking at the number of cases that are being detected on a daily basis. Probably smooth over time because there's lots of fluctuations from one day to the next, because weekend versus weekdays, etc. But we'll be monitoring that very carefully to see whether we have relaxed too much too soon. You look at some countries like Germany, so they went into lockdown, I think, earlier than us, and then they exited lockdown earlier than us. And they've seen a bit of a rebound since then. And that's maybe suggesting that they have over-relaxed control, and they should have gone to something a little bit in between circuit breaker and what they've actually moved to. So we'll be, I think, tailoring quite carefully the response over the next few months to make sure that we don't relax too much too soon.
Well, Professor, we haven't received today's hospital discharge numbers yet, but based on yesterday's figures, 15.6% of COVID-19 patients have been discharged. The government has also said that 20,000 migrant workers will be discharged by the end of May, which is the majority of our current number of total cases. So, in light of our daily number of cases, is this a good proportion? Or do you think this number means the tide is turning for Singapore?
It sounds like it's a small fraction of our overall cases who've been discharged to date, but this is partly because the epidemic, most of the cases in the epidemic have happened more recently because of the outbreaks in the dorms. And so the cases which have been discharged are the ones from earlier on, and there's fewer of the earlier cases. So I think that it is a very good sign that for the majority of our cases, they are either discharged already or looking like they will be discharged over the next few weeks.
Prof, we are reading about the possibility of another wave in infections in countries like China, South Korea and Germany as well, stemming from the lifting of some of their movement restrictions. What lessons can Singapore draw from these examples as we prepare for further easing?
Yeah, that's also a very good question. The virus has not become less transmissible just because circuit breaker has been implemented. It's a temporary reduction in the transmissibility of the virus. If we completely relax our guard and we go back to life as it was back in December or November last year, it's a very long time back, right? Then you will end up with something that becomes like an exponential growth in the number of infections, and you'll see the kind of situation that we see, for example, in Korea, China, or Germany. So I think that it will be very important to monitor carefully the numbers of cases over time, making sure that we're not getting to a situation where the epidemic appears to be going out of control. And ideally also monitoring other surveillance streams. So for example, Google have got this very nice mobility trends data set, which shows how much movement has changed over time. We can monitor that to try to look for early warnings that possibly too many people are going outdoors, having contacts with other eagles, rangers, etc., and use that as a proxy for subsequent cases over the next week or so.
That was Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health at NUS. He doesn't think Singapore has reached our peak yet. And in the second part of our interview, he looks ahead to June the 1st, when the circuit breaker measures are scheduled to gradually lift. That's coming up in a bit.